This morning we had a symposium which was titled An Update in Movement Disorders. It spanned various movement disorders. So we heard presentations on essential tremor, which is the commonest tremorless condition known. We had presentations on dystonia. We had presentations on Parkinsonian syndromes such as multiple system atrophy and progressive supranuclear palsy. My own topic addressed non-motor symptoms of Parkinson's, and in it what I focused on was the fact that non-motor symptoms were mentioned way back when James Parkinson originally described the condition by himself. And it has remained an under-researched area and a key unmet need in Parkinson's. And now we know non-motor symptoms can precede the motor diagnosis of Parkinson's for many years. And it's emerging as probably one of the most significant aspects of the different symptoms of Parkinson's. And perhaps also another new feature that I talked about was the emerging subtypes of non-motor symptoms with Parkinson's. So some Parkinson patients have a lot of sleep problems, some have a lot of depression, some have problems with pain, some have problems with autonomic problems, but they're not all the same. So one size doesn't fit all. And I think the time will come when people will be focusing on different treatments for these different subtypes of Parkinson's. Therapies in Parkinson's disease, I think in future, will focus on two main areas, well, possibly three areas. One, the key area where we are very good is the treatment of the motor symptoms of Parkinson's. So that's the standard dopaminergic treatment to treat the off periods, to improve the on periods, to reduce the dyskinesias and improve quality of life. The second area, which I think is going to develop and at the moment remains an unmet need, is the management and treatment of non-motor symptoms by new therapies. We now have good quality trials for pain in Parkinson's. We have reasonably good trials for sleep in Parkinson's. So I think in future we'll see many more trials addressing the non-motor symptoms in a big, good, robust placebo-controlled trials. The third area where I think new medicines might have a role is neuroprotection or neuromodulation. At the moment, we don't have any good neuroprotective therapies available, but again, we hope that in future we will have some more available for us. Non-motor symptoms are now recognized to be there before the motor symptoms start, and then it stays all through the journey of a patient as the motor symptoms progress over the journey of Parkinson's. Some of these non-motor symptoms occur at the later stages of the condition, others such as reduced or lost sense of smell, some sleep disorder like REM behavior disorder or excessive daytime sleepiness can be present for years before the patient's diagnosed to have Parkinson's. The impact of these individual non-motor symptoms on the quality of life can be enormous, not just for the patient but also for the carer, and particularly because we don't really have very good treatments available for these symptoms. So the overall impact is enormous. I'm afraid in clinical practice we're still not measuring non-motor symptoms as much as we should, in spite of availability of very good tools that can be used in the clinic. And I think the real challenge is to spread the message so that measurement of non-motor symptoms becomes obligatory in the clinic. Stem cells have been researched now for a fair length of time, since the 90s, and it holds great promise for Parkinson's. The only caveat is that it really addresses the dopaminergic system of the brain, when we know that Parkinson is a very heterogeneous condition which affects the cholinergic system, the serotonergic system, the noradrenergic system, to name a few. So we need the whole stem cell approach to be more global in some ways, to be more universal, so it approaches the whole system rather than a specific dopaminergic deficiency. That's probably the only area that it needs to develop into further, and I'm aware that research is going there, but it still be a little while before it becomes of widespread use.